first, the fact that such independent body as WHO is declaring that certain component of the pollution is related to health and is declaring that it's causally related to health has very strong meaning. This hazard assessment of the pollutant out of many pollutants. So it's focusing attention on certain type of pollution. Second aspect of the guidelines is indication of the magnitude of risk, how much risk is elevated, increased at certain concentration, and also recommendation given to everyone about recommended level of exposure. I mean, how low you should go to be relatively safe. It is relative because we learned more and more that we don't see for most of the pollutants which we study and for which WHO has guidelines. There is no so-called safe threshold. And we also don't use safe level of risk. But there is a way to say what is really low risk. Yeah? So there's consensus-based process where for those exposures which are causing diseases, the agreement is to which level we should go to be relatively safe. And this kind of message, this kind of recommendation, which WHO is giving, is unrelated to the actual conditions where people live, and is not looking at feasibility of achieving this level. So it is driven by the health of the population and the magnitude of risk. So we are not looking at various aspects which are considered when, for instance, national standards are established, where governments must consider how much would cost achieving on a certain standards, which industry would be affected, and which group of workers would make a protest to avoid some kind of changes in the industry or in the activities. So this kind of a benchmark from which countries may look and say, okay, we have some trade-off, poorer health, but less costs to improve health. And if it is done in a honest, transparent way and accepted by the population, I mean, this okay. Very often those national standards, let's call it realistic standards, are working more effectively than WHO guideline applied directly would work, because in many countries very radical change in exposure is not feasible in a short time. Short time means 5-10 years. Now, so it's better to say, to set an objective which is easier to achieve, and achieve it, instead of saying, no way, we are not going to achieve this objective, so it's better to do nothing. So actually the guidelines predicted this kind of behavior, and that's why the guidelines have interim targets proposed, and kind of arbitrary points, but we can say we can see it as steps on a ladder going from poor air quality to something which is better and maybe even very good. Progress is never done in a step way. It is done, or never, or in most cases, it must be a gradual. So this what guidelines propose to the countries.